Welcome back to the Able to Care podcast. Today's episode is really important because we're talking about trauma, not in a neat theoretical way, but in a messy human reality about how it shows up in behaviour, relationships, parenting, and the systems people have to navigate. Too often, what sits underneath distress gets misread as defiance, dysfunction, or failure, and that can leave people feeling judged rather than understood. I'm joined by Ethan St Pierre, a lived experience trainer and public speaker, but also Dr. Alice Loving, a family intervention specialist with a deep background in child protection and parenting work, and Azariah Hope, director of Futures Rerouted and a powerful lived experience voice in this space. Together, we're exploring what trauma can really look like, what people so often get wrong, and how we can respond in ways that help people feel safer, seen, and less alone. So if you support children, families, or anyone carrying pain that gets misunderstood, this conversation is for you. Well, thank you very much all for joining. So I'm going to dive straight into this question. I'm going to go to each of you individually on this because I think it'd be good to get everybody's perspective. We'll start with Azariah, if that's all right. Sure. When people hear the word trauma, what do you think they most often get wrong?
That it's always visible. It's one trauma or therapy is going to fix it all. Are the main topics that tend to come up very quickly, not just as a parent or a care experienced child, but for anybody who experiences trauma. There is this image that people see, shaking and panic attacks and a really good therapist for 6 sessions and you will be a completely changed person, and that's all it takes. And if it doesn't, you are somehow abnormal. And actually, when you hear trauma, you also think unhealed trauma means perpetrator because of the stories that come from those who do go on to demonstrate perpetual behaviour, that their stories once started with them being victims.
That's a really interesting perspective. Thank you. I'm going to go on to Ethan to get the same question. So when people hear the word trauma, what do you think they most often get wrong?
That it's always a weakness. I think trauma is always framed as you're broken or damaged, or that in some way you're not going to succeed in life. And actually, trauma has been one of my greatest teachers. The hardships of life have led me to this work. Without all the things I've experienced, I wouldn't be able to do what I do. I wouldn't be able to support people the way I support people. There was a lot of wisdom in that suffering. Obviously, it's a terrible price to pay. It's not something that I'd wish on everyone, but it's framed like you're never going to do anything. And actually, trauma can open a lot of doors for you. And it can also bring like a lot of love. I think it was Carl Jung said about the wounded healer. I've met some people that have been horrifically traumatized, gone through the most horrific things, and they've come out of it the most beautiful, loving, compassionate, empathetic people. And I suppose when I started this journey, trauma was always seen as something you're going to end up in jail, you're going to end up a drug addict, you're going to have your own children taken off of you. And actually, it can really soften and bring out the best in humanity as well. It's that choice, isn't it? When you're traumatized, it's what are you going to do with it? You can't rewrite the past, but you can define who you're going to be with it. So the world's ripped you apart, say as a child, or as an adult, and you've had these horrific experiences. Are you going to be angry and rip the world apart? Or are you going to meet that hate and that pain with love and compassion and understanding? I think it's really important that trauma is framed that you can do something with it, you can heal. Maybe you'll never be the person before the traumatic thing happened, but you're going to be something new. There is a cost to it. But it's also, some of my greatest attributes come from the fact that I was traumatized as a child.
I suppose it sounds like you're sort of saying that your past has shaped you, but it hasn't defined you.
Yeah.
It's interesting that we'll definitely come back to some bits that you mentioned there, Ethan. Thank you. Alice, would you mind adding your perspective into that same question, please?
Yeah, so kind of two things come to mind for me. One is the idea that people often focus on the trauma was the event, the things that have happened. But lots of people who've been through trauma will say that actually it's the impact afterwards. It's not the event itself. It's the way in which what has happened to you is impacting on your daily life, your experiences, your relationships, your interactions, how you see yourself. That's kind of where the impact kind of most lies after those specific sort of events. And I think the other thing I would add is the kind of, sometimes there's the perception that if you've been abused as a child, you're likely to go on to, abuse your own children. And that is categorically incorrect. What often causes the potential intergenerational cycles of abuse and harm is whether or not that person's had the opportunity to resolve that trauma. They've had the opportunity to make sense of it, to process it. And that requires input, that requires intervention, that requires support. So yeah, I think that those are probably the two things that come to mind for me.
It's really interesting. I suppose whether it's just from the professional capacity that I've had, the kind of that label, it seems strange to me. Maybe I take it for granted that I don't associate somebody who's experienced trauma with any of the negative things that kind of you're referring to there. So it's really interesting to kind of hear that perspective, almost a stigma or a kind of a judgment based on you because of those experiences. Maybe it's, I'm from foster care and adoption as far as I've been the parent. And therefore, the kids I've had in my world have been amazing. And therefore it's a case of, it hasn't defined them. It's just something that has been a challenge for them. Do you think there's a kind of an oversimplified view of, almost as you said there, Alice, that kind of event that people have one set idea of either that is traumatic or that isn't traumatic? How would you feel? I see you nodding your head there, Azariah. So do you want to say that one first?
Oh, absolutely. I think there is this idea, and I can use the example of I attended a Marak, and one of the head leading that Marak had said, well, despite scoring quite high, there wasn't physical abuse, so this isn't domestic abuse. And I was almost dumbfounded, because what you think trauma is actually couldn't be further from it. And actually what trauma has taught all of us is actually we can't shape an experience as traumatic based on the events themselves. It is the consequences of trauma, which is why those who lose a cat, for example, many people may not understand that, but what that person is left with after that is traumatic. But because the focus is on what happened as opposed to what a person is left with, I think it's a risk towards how we are managing those who are traumatized, no matter what the event. But there's definitely a lot of learning still that needs to take place within professional settings in how that's viewed and how we respond to that.
Have you experienced that within your professional capacity as well, Alice, that you've kind of come across? Is there other professionals that don't seem to get it?
Yes. Yes. So I think probably the most common one is, so in my teaching, I kind of focus on trying to talk to practitioners, social work practitioners, about the way in which, if a parent has had their own attachment-based trauma, so they've been significantly harmed or abused in their own childhoods, a lot of the mechanisms that might come to the forefront in their interactions with social workers are kind of defensive strategies that they've been using. And in their childhood years, they probably served them quite well. And the two kind of areas that I teach around is to highlight the fact that somebody's brain might defensively cope with that trauma or have coped with it in childhood by more quickly going into a state of what we call hyperarousal. So more regularly becoming quite dysregulated, perhaps becoming more angry more quickly, more aggressive. And that has been a strategy to keep yourself safe. Whenever you feel slightly under threat, you're more quickly to kind of jump to that position. And of course, having a social worker come into your life, the threat of your children being removed, that's probably going to trigger that mechanism a lot more easily than if those hadn't been your experiences. So I'm not saying that means that social workers should tolerate parents who are behaving aggressively. That's not the point. I think what happens very quickly is that behavior is taken at face value without that deeper understanding of this parent is feeling fear, and that fear has led to the anger. And so how can I practice? How can I present myself? How can I have a conversation with this person where I'm keeping that fear in mind rather than my process, my strategy, my objectives of what I need to get out of this visit or this conversation? Then the other side, quite oppositely to being more triggered into a hypoarousal state. Hyperarousal state is a hypoarousal state. So that's quite the opposite, where your brain kind of has, again, kind of defensively coped with those harmful interactions by just becoming really disconnected, really shut down to conversation, to interaction, to relationship. And that can make you present as quite flat. It can have a huge impact on also you connecting with your own children, because although they're not a threat or a harm to you, that process of like being taught that all relationships are harmful can really play like quite a big part in that bonding process at the beginning, and can cause you to present as very flat, demotivated, not engaging. So I think bearing in mind that these are some of the things going on beyond what you're seeing on a superficial level is so important. Like what we are doing as a service in children's services, we are working with really complex stories and complex behaviors. I think I said on the podcast with you last time, we can't just think that we can change ingrained patterns of behavior and defensive coping strategies by putting things in a plan and writing down what people need to do differently. It's so much more deeper than that, and it requires so much more thought and process and provision.
I'm gonna come to Ethan in a moment. I just wanted to comment on something you mentioned there, the hyper and the hypoarousal. I think that's something that contributes towards stigmatization, because which of the parents are going to be noticed? The ones who are potentially aggressive, they're the ones who are being stigmatized, or the other end is they're neglectful because they're shut down, they're disengaged, and those assumptions you said about behavior. But I think sometimes the ones that's going to be talked about are the ones that are perceived as aggressive, defensive, which creates that stigma maybe about the violence, aggressive, dangerous, whatever kind of perspective is there. And I think that's is something that people don't get sometimes. I was doing some coaching and consultancy with a mum who's struggling with an older daughter. And it was a case of like, she did something very simple, like did the washing up, and her daughter was really angry with her. Like, why have you done that? Why? And she was like, became defensive. And I said, but this is you struggling with other stuff in your past as well. That anger is something that you find repellent, difficult, overwhelming. Imagine your daughter and him cried instead. Become upset, being able to be vulnerable with her emotions, to kind of go, that's made me really, really sad because it's made me feel like you don't think I'm good enough at looking after my own house. And it was that kind of the repulsion of anger rather than actually being able to, it was a different emotion that had been shown, something that was felt more nurturing and automatic to be nurturing. That's when people find it much easier. So that's kind of in line with what you were saying there.
Mm-hmm. And picking up on what you said at the beginning, I think also, you're right. The parents that are potentially more aggressive, more dysregulated, that suddenly becomes a massive focus. And I've worked with a couple of families within the last year where that has just taken over everything, and the child has got lost in this process. Mm-hmm. And even a guardian has started to make links between how this parent is interacting with the professionals and her parenting of her child. And it's like, there's not a linear line. How she reacts when she feels under threat, it is not the same thing as how she's interacting with her child. And there was very little evidence of her behaving in, an aggressive, punitive, way towards her child, but they kind of just linked the two together, and they were like, this is who she is, you know, as a person and a mother, and because this is how she makes them feel, but that's not how she makes her child feel. And we really need to make sure we do that clear distinction, and that those feelings don't get mixed up. And, you know, really good reflective supervision is totally part of that, you know, where you can be talking through what's coming up for you, and being a bit clearer on those sorts of distinctions of feelings associated with the parent compared to, you know, what's going on for that child.
Well, it's the nature of labelling, isn't it? When a politician tells a lie, we call them a liar, but I guarantee they've also told truths. We never call them a truther. And you can't be a liar and a truther at the same time. We all are guilty of labelling based on one interaction. Ethan, did you have anything you wanted to add in to what was being said there?
Well, I think Azariah hit it on the head there, that it's individual. Trauma can be individual, and I think characteristics of a person can have an effect on how traumatized a certain event is and how untraumatizing it is. For me, trauma wasn't spoken about through most of my life. It's a big focus at the moment. People talk about that. My behaviour was just bad. I was violent. I was angry. I was an animal, but it was out of fear. Alice touched on it. Out of fear, I was always afraid, and my behaviour was to lash out, because if I lash out, you can't hurt me. But again, depending on the situation, you can go into different responses. And a social worker turning up, if a social worker turned up, in a normal household, you would start feeling anxious. Why are they here? What's going on? I think the situation as a whole is triggering, activating, whatever you prefer. I think the association between social workers turning up and removing children automatically puts you in a state of fear, or shut off, don't say anything wrong. And I think it's biologically, we're designed to protect ourselves. We are designed. Trauma is just part of our lives. It's part of our existence as human beings. And sometimes we don't always have control, but you can be labelled as violent or aggressive or uncooperative. And actually inside, you're scared. You can't be truthful. You can't speak up because you don't know what the response is going to be. Sometimes you have no control over it.
Yeah, and very contextual. And that kind of was leading into the next question, and maybe there's a little bit of repetition here. But when behaviour does get labelled as attention-seeking, aggressive, manipulative, or non-compliant, you've already kind of referred to it there a little bit, Ethan, of what's going on is fear. Would you agree with that as well, Azariah?
I definitely would. And funny enough, those were all titles that lived through every part of my childhood. Attention seeker, manipulative. And actually, the term attention seeking in itself sounds ugly, but it's not wrong. It's not wrong in what it's doing. And actually, I think what gets missed for older children, teenagers, and care experience or traumatized parents is that behaviour is still a communication, and a lot of that can be stunted by the episodes of trauma, like the ages that they were when those traumas happened. So there are so many layers in that. And I think because those labels are in play here, all of a sudden it screams red flag, risk, concern, safety issues, instead of going, okay, what's missing? What is trying to be communicated? What's our role in this? And if we can't do something here, how can we create a space where this child or parent can now find those words for what it is that their body is now showing us as a problem, or their voice is telling us? I think it's one of the reasons why, quite controversially, I have a problem with these labels, or I have a problem with even the term perpetrator, because actually, in my story, a lot of what took place, I would consider a perpetrator, but I was also considered a victim. And actually, had I always been focused in that lens of perpetrator, I wouldn't be parenting children now. I couldn't work in the fields that I do, because actually those labels not just change how parents are supported or people are supported, but how they're viewed and the parts of them that actually have nothing to do with that, but also the proactiveness to understand it for that individual so that the work can be done. Because more often than not, traumatized people will, when they do have that awareness, go, gosh, why did I act like that? Why does this keep happening for me? And there is no solution. But when those solutions do come into play, and it does, for many of us, takes longer than 6 months. For me, I can say it took 5 years and we're still going. But it is that, okay, I'm curious now, no judgment to myself, but how do I now do this? Who do I need to speak to? Where do I now get the resources I need to address this thing? Because my aim isn't to hurt anybody. My aim is to care for the people that I love and that are in my world. But my body and my mind still hasn't got to grips with the fact that outside of all of those traumas, I am actually safe. We just now need to replace those mechanisms with something that doesn't cause us and the world around us further disruption. But we need the world around us to understand that and walk with us.
Both of you kind of mentioned something there, or referred to something. So you said about the labels, and Ethan, you were saying it's very contextual. You know, what might trigger me a certain behavior in one place might be different in a different place. You were referring to the attention seeking. One of the things, like, I'm an attention seeker. You know, I run podcasts. I stand at the front of rooms. I am happy to admit it, but I love attention. You know, I'm an extrovert, a weird extrovert introvert. So therefore, I want to be on stage and talk to everybody. But then once I'm done, I want to hide in a room and not engage with anybody for about a week. But those labels, and I can be aggressive. I know I have manipulated in the past. What do you think it is, though, that, as you said, sometimes there are positive ways of gaining attention, and we might see them as positive, like doing a podcast or going in front of the stage. And then there's what we perceive as maladaptive ways of gaining attention, which is like acting out, for instance. And maybe, Alice, why do you think people jump to the kind of the assumption that they're judging the behavior rather than exploring the function of the behavior behind? Because I know that's a lot of the stuff you do with your work, that even when you're supporting parents, it's the mother is sometimes perceiving that from their child, of going, the focus on the behavior rather than the feelings of what's going on behind.
I think there's probably a lot of reasons. I mean, from a professional perspective, we have to remember that social workers are all human beings, right? So they are just human. So they're going to have reactions that are ways that are just about being a human being who suddenly now feels under threat or confused or angry themselves, you know, like all of those emotions are very, very real in them too. And again, that's why, going back to the supervision thing, it's like, process all of that. You need a space for that is not just like, you know, go, or avoiding it or not talking about it. It's just not the same thing as having a gentle conversation with a colleague or like really being able to get into it. So I think some of it from a professional standpoint is probably just, reacting. And it's also easier, isn't it, to just take things at face value, to make a plan, to have a judgment. It's just easier, you know, doing what's going on beneath, being curious to really understand this person's life and their strategies and their defensive coping mechanisms. That takes time, that takes thought, that takes depth. And again, you know, a point that I made, I think, on the last podcast with you is that the time scales of everything are so incredibly tight, and practitioners are forced so quickly to actually move out of that why space and move into the what needs to happen. And the what is much more of a focus on, this is the behavior, this is how it needs to change, and not doing sitting in that space. And, you know, I teach hundreds of social workers who say, we want to do more of the why. We want to be in that space for longer. We completely accept that we need to do more of that, but we are forced into very quickly, you know, the stages of procedure. And then I think lastly, for both practitioners and parents, one thing that will inhibit you from seeing beyond just the behavior and actually going deeper into what is this child thinking and feeling, or what is this parent thinking and feeling, which links into our ability to mentalize, is that your capacity to do that, your capacity to mentalize, is compromised when you yourself feel stressed, feel upset, feel angry, and your child will trigger that feeling in you. Potentially, as a practitioner, a parent might trigger that in you, especially if they suddenly are behaving in an aggressive way. So that is naturally compromised when your own feelings are at the forefront. Hence why I've said, it's so important to process that and think about what's coming up in those interactions, whether you're a parent or a practitioner.
So for anybody listening who kind of supports children or families, what are the signs that what they're seeing might be stress, fear, or trauma rather than simply bad behavior? Ethan, do you want to kind of pick up on that one?
Yeah, I'll just touch on the previous one as well.
Of course.
I think, firstly, it's amazing that these conversations are being had. Like today's conversations becomes tomorrow's culture, becomes next year's practice. These conversations is what's going to lead to change. And it's always really difficult because it sometimes comes across as like an attack on social workers or social care. And actually, it's full of really amazing people. Throughout my life, I had amazing people, but sometimes their hands are tied, or sometimes it takes a while for things to come through. And language is really important on us, especially when it comes to children, how we speak about children. And I know that's massively changed. How they spoke about us is very different, very different. Promiscuous was one that was used a lot in my children's home around children. Well, why is a child being promiscuous? And how can you call a child promiscuous? It's just love seeking, isn't it? It comes from low self-esteem. I'm going to do anything to get attention. I'm going to do anything to feel loved. I'm going to do anything to feel important. How we talk about children is so important. So important. Children are a lot, they're victims. But how I behaved as a child isn't how I now behave as an adult. And yet I still have all the same experiences. I wasn't capable of processing how I felt. And yet I was labelled and moved and not wanted and pushed around. And then what was the question? How do we know the difference between bad behaviour and
then understanding stress, fear, and trauma? Yeah.
It's difficult, that, isn't it? I suppose. Is anyone bad? Is any human being born bad? That would be my question. And I think Azariah touched on it. We're good and bad. I've done amazing things in my life and I've done terrible things in my life. I get it wrong all the time and sometimes I get it right. I don't think innately anyone's born bad. I think we're shaped by what we learn, what we see, how we feel and how we function. If a child is acting out in their behaviours, I think Alice touched on it. We've got to look at the why. Why is that? Because a happy, secure, safe child is just full of love and laughter. It's a joy to be around. They're just full of all the best parts of humanity because they don't know about the world. They don't know about paying bills. They don't know about the stresses. They don't know about the bad things. A cared and looked after child, majority of the time, is in fantasy, living off into all the really fun parts of their aspect. If a child is behaving in a way that isn't like that, I think there's always a why. There's a reason. I don't think any child's bad. And I think we have to be careful at looking at it like that. Because it sort of, I think the thing that I reflect on now is it fed in to my low self-worth. It fed into the fact that I was unwanted. It fed into the fact that I was unloved or I was broken. And actually what it was is a really confused child that had been born into a situation that I didn't understand, didn't know wasn't normal. And I looked around my life and everyone else had a family. Well, I'd never known any different. How can I behave in a way that is socially acceptable or normal when I don't know what that is? So yeah, it's I think my connection just went there.
It did for a moment.
I did,
yeah.
I did an internet check beforehand as well. So
we thought it was a dramatic pause. I really liked it. It's like,
we're all like, marinate for a bit, not like to let it marinate. I think we got to be careful with looking at children as bad because it reinforces their own feelings. For everything a child is saying or doing, they're possibly having 100 thoughts around it themselves. I just remember always feeling worthless and useless, and then it was reinforced to me. And I didn't half the time know why I was behaving why I was. Even why you jumping on the tables in the classroom, I couldn't tell you. why did you go into a panic and attack someone? Well, there was no reason to do it. I was triggered. Could be anything subconsciously is happening within me. I don't have the ability to tell you. So when you punish me and send me to my room or exclude me from school, all you're doing is proving that internal voice right, that I am broken, that I am wrong, that I am bad. And I wasn't. I was just scared and lost.
And can I just add to that, because I'll come in with the really boring theoretical term for the incredible experience that Ethan has just described, which is a term that Bowlby came up with, which is about the internal working model of self, and he's just described that brilliantly. So a child will create a model of themselves that fits with the experiences that they're having. It's totally related to those early relationships and that input. So what they start to do is they behave in a way that fits with that model. So I might have been told that I'm naughty, nasty, horrible. Well, I behave in a way that fits with that because that's who I've started to formulate is myself. And then the problem is that when I behave in that way, it's the way in which others interact with me, the way in which I get kicked out of schools or foster care or whatever. Each time that happens, it's reinforcing again that this is who I am. I am this naughty, nasty, horrible person. And it takes a huge amount of input, potentially from other people around you, to help you to create a new internal working model of self. And when I do training with foster carers, I talk about that a lot, that it is possible to adapt and change this model. But certainly at the beginning of a child being placed with you, they've got this model of self and it's like, God, this doesn't fit here. And it's a really confusing, scary sort of experience. So I also often say, that old model of self never quite fully goes away. So when that child might feel, even if they are adapting kind of new ways of being based on their relational experiences and what they're receiving, when they do feel, extremely angry or upset or stressed, that old model might creep back in. So it's holding space for that and understanding that, but also taking that concept for me in how I'm talking to social workers about how they're working with parents and taking time. I've got a session that I do in my training where it's like, sit down with a parent and find out how they see themselves. And based on that, some of them might be so detached from self that they find it really hard to even answer the question. So that's a starting point in itself. But also being able to help them to connect with what is their child's internal working model of self, because then you can understand that behavior a little bit better. And the great thing about this is teaching a parent that how your child is behaving. Let's say we've got a child who's particularly challenging, right? I can say to them that is linked to how they see themselves. And the great thing is your relationship with them is a really key ingredient to how they see themselves, which is therefore central to changing the behavior. So you want to reduce some of those really challenging behaviors. Well, the answer is in the relationship. That's where our kind of solution to that sort of lies. So sorry, Ethan explained it brilliantly from an experience perspective. I'll just give you the kind of boring theoretical perspective.
Right.
No, it's spot on. I think there's a few things you touched on that are worth referring to, and I think it comes in all sorts of forms when you're saying about the inner narrative or that inner working model. Somebody who's often described as clumsy is another example, isn't it? They're labeled as clumsy and therefore, guess what? They knock a lot of stuff over. And it's actually that self-fulfilling prophecy almost, those core beliefs. And those core beliefs in early life seem to... A great example I try and get people to think about is people who struggle to get a compliment about their looks because their core belief is, I'm ugly. So then somebody goes, you're beautiful. They goes, I don't like that, because it's that kind of dissonance, question everything they think they are. And therefore they struggle to accept that alternative view of themselves. And just to add on one story from what you mentioned there, and I'll come over to you, Azariah, was some friends of ours that were foster carers. This is just a prime example of the example you gave there. I met a lad who was living with them for a while. He was the epitome of the charming child when I first met him, because I was a stranger, and therefore it was that masking, and therefore he was very, very charming, very, very lovely, opened the door for me, asked me how I was. I was like, oh, you're lovely. But I knew that he'd taken a poo on their kitchen floor just the day before. So that charming child had taken a shit on their kitchen floor and blamed the dog. Now, I think people struggle with that, going, see, he knows how to behave because he can do it. But it's a case of that's masking sometimes. I'm not a safe person, and therefore he's developed the ability to potentially, and I refer to this like my own mental health, whereas there's been times I've been to social events where nobody would have known how depressed I was. So does that mean I know how to be happy, but I'm choosing not to be? And that's exactly the same for him in a way, isn't it? Like he knows how to behave, he's just choosing not to. No, in that moment, it's the only way he sees himself to be safe. But the reason he pooed on the kitchen floor is because contact was coming up. Mum has 3 kids. He's the only one in care, and he needed to remind his foster parents he's rejectable. And it's that kind of I must act out bad to show you how bad I am, in a way. Is that kind of what you're referring to there, Alice?
I mean, yeah, and that's an act of control, isn't it? Because that's one thing as a child that they can control. It's similar to eating, but just the opposite end, I guess. But yeah, I mean, that's a huge thing around control. And again, the kind of term that comes to mind when you're describing this is something called false positive affect. So learning that I can put on this positive interaction as a way, again, of just keeping myself safe, and I can present in this way. But that can be completely misinterpreted for what is going on below the surface, for sure.
Did you want to add anything in on that, Azariah, to the how do you tell the difference, the bad child perspective?
I can't get on board with anyone being a bad anything, because again, that boils down to the labels again, and put them in a box. You then take away any curiosity around solution-based thinking. And another really important aspect, particularly as we're talking about children, developmentally, they will push those boundaries. That's a part of them formulating who they are as a person. And as they're building their relationships with their families, with schools, that will look different. And then if you factor in all the other things around neurodivergence, then you've got a whole different ball game now that we need to consider per child. What are their dynamics? What are the genetic characteristics that they may have inherited? So whilst we know that obviously there are certain actions that aren't genetically inherited, there are characteristics that can be passed down, i.e. risk-taking behaviour that may have stemmed from neurodivergence with first parents, but as they've had their own, those tendencies also then play a part in their children. And again, if you lose that curiosity to go, okay, where could this have come from? How is this happening? Is this developmentally? Is this about parenting? Is this about how they're viewing the world around them? And if we just kind of narrow it into one could be, I think we lose that sometimes there are personalities that, particularly for children, we're kind of guiding them. We don't want to lose themselves, but we want to kind of help them channel those parts that could potentially be seen as being badly behaved. So when you have a child that constantly asks you why, or they don't want to do it because it doesn't feel right for them, that could be considered as one of those grey areas. That's not trauma. That's just them not wanting to do something. But if you stick with that thought process and forget, actually, they're little people. They are now going to look at the world very differently and figure out, where's my lines? Where's my boundary? Where's my feelings in this? Then I think we are at risk of kind of squishing them into a box that actually doesn't fit them. Finding that line between, yes, you're a child and I'm here to protect you and guide you, but how do I let your personality show itself? How do I let you form yourself in that too? Which is not easy at all. And so I would, even with people who are labelled in my story as perpetrators, I would hesitate before going, they're bad, they're evil, they're this, because actually there are so many moving parts, and half of which we may never have enough time to figure out. And so it's more about figuring out whether there is a space for them to actively navigate that for themselves. And if I'm around those people, is it safe? And if it's not, still being able to go, I'm not going to put you in that box. However, it's not safe for me and mine and my world. And I think that's something that, as difficult as it can be, and it doesn't come naturally, I think it takes a lot of work from everyone. I think if we take that approach with most things, I think we take that ceiling off when we're talking about how do we support these complex situations, these parents, these children who don't react in a way that society expects them to.
Sorry, I know you've spoken, or one of the things you speak about quite a lot is labels, and you mentioned that label of perpetrator a few times, and about one diagnosis shaping the kind of identity before later then being removed.
Yeah.
What do you think, because obviously we do use labels in all sorts of ways. I gave the example of liar and truther and things like that. What can labels explain and what can they sometimes hide?
I think labels can give context if used neutrally to maybe what somebody could be experiencing. And for example, when we're talking about your personality disorders and stuff along that line, I think it shapes to the degree of how someone's brain was wired, which I think in my own personal story was really helpful, because it let me know that firstly, this isn't going to be a quick process that I was being led to believe would happen and needed to happen sort of thing. This was going to be a lifelong process. However, it then hides with labels like that how that could have possibly come to pass, and actually what are the gaps? Is it mentalizing? Is it the ability to see direct impact in front of you towards yourself and others? Is it my own communication? What am I trying to communicate when these feelings come up? Because you can almost be influenced with labels like that to go, I'm a write-off. I can't change. I can't be different. There's no saving me. I will be a harm to my children forever. And therefore, am I even capable of loving and creating a world of my own? And that can be really tough when those labels come about, because you're not just now dealing with the technicalities and all the science, but then you're dealing with how the world views those labels and how that influences how they interact with you, how they work with you, and that trajectory that lives in children's social care system, that with labels like that, it is 10 times harder to convince a courtroom or convince a panel of professionals that actually investing in my recovery in order to give me the opportunity is worth it, because it's lifelong, it's constant. And so it was one of the reasons after my diagnosis of emotionally unstable personality disorder was removed, I remember the psychologist was like, you should be happy. This is a good thing. And I was like, I've just spent 6 years of my life thinking that I am towing the line for the rest of my life, that I am going to have to, this is a secondly, I'm choosing to do things differently every second of the day. And this has been exhausting. And now you're telling me that whilst I know complex trauma is still something I'm working on every day that I'm here, it's a different thought process. All of a sudden, professionals are talking to me different, and I'm understood and respected and in how I articulate myself far better because that diagnosis was removed. And I think fundamentally there's so much wrong with that and there's so much injustice with that. But just as a human being, it was one of the saddest realities I think I came to with those labels. And it was at that point I couldn't get on board anymore with this disorder, that disorder. Show me you. What's the things that make them think that? What is it that's leading to that diagnosis? And we can work with that. The label doesn't matter. We can work with the experience, the behaviors, the thought process, the everything that ties into that. But just don't give me the label.
Have you ever encountered an adult or child's behaviour that has felt difficult, overwhelming, or challenging? Have you sometimes felt at a loss of what to do, or know that you didn't handle it quite right? People are complex and unpredictable, and their behaviour can be like the weather. We've all made the mistake of looking out the window and feeling safe to wear shorts but 5 minutes later, wishing for an umbrella? What if, like a weatherman, you understood how humidity, temperature, and pressure all come together to cause the weather, allowing you to better prepare, predict, and respond, and prevent ever having a picnic ruined by a thunderstorm ever again? My book, called Targeting the Positive with Behaviours that Challenge, helps you to become the weatherman of behaviour. It provides you with a toolkit to increase competency, confidence, resilience, and empathy, so you feel more assured about how to respond to distressed or dysregulated behaviours in others, including those affected by trauma, mental health, neurodiversity, learning disabilities, or dementia. Build better connections, achieve de-escalation, and improve outcomes for yourself and those you engage with my celebrated 6-stage target model, a step-by-step process to reduce distress for everyone. Discover my empowering, person-centered guide in Targeting the Positive, written by me, Andy Baker, available from online bookstores worldwide. Find a link in the description and order today.